Tramadol. Today we'll be talking about tramadol, what tramadol is, the withdrawal effects of tramadol, why you should not take tramadol if you've not taken tramadol before, and I'm going to give you the 7 ways you can stop tramadol if you're having withdrawal issues, if you're finding it difficult to stop tramadol. Please, this is a very important video, so please do not skip at any point. Okay, my name is Nurse Merit and I'm a renal nurse. If this is your first time joining us, please subscribe and like. Here we'll teach about health, we'll teach about things that will help you improve your health, both women health, men's health, and general health, especially the heart and the kidneys. So please stay tuned. Now, what is tramadol? Tramadol is a drug, a painkiller that treats mild to severe pain. And tramadol, because of the euphoric effect it has, it's very addictive. It is very addictive, and people can depend easily on tramadol. So this is why you should not take tramadol except if you've not taken it before, except it is being prescribed by your doctor. And please be careful to know when you should stop, and let your doctor know how long you're taking the tramadol. Stop when you're supposed to stop, and do not continue any medication at all, especially tramadol, if your doctor has asked you to stop. Okay, let your doctor know. He can give you other alternatives. Okay, so now, having known about this, we'll talk about the effects of trying to stop tramadol, the withdrawal effect of tramadol. Tramadol withdrawal effect is so serious. It is so life-threatening that it can kill, it can lead to death. There are some mental and psychological effects of tramadol withdrawal. For instance, there is hallucination, thinking you're seeing something when you're not seeing anything. You're seeing a human being, meanwhile what is actually there is a tree. Somebody is smiling at you, meanwhile what you're seeing is that the person is furious at you. These are the effects you can see while trying to wean off of tramadol. Okay, so don't try to stop on your own if you have been dependent. Another thing, withdrawal symptoms can be depression, serious depression, suicidal attempts. The person tries to kill him or herself. Tremors, your hand is shaking, your body is shaking, you cannot concentrate. Okay, and some other psychological and mental effects of tramadol. And then again, serious hunger, serious hunger and urge for extra tramadol. So it is very important to know that tramadol these days are no longer given by hand. They are no longer swallowed. Most people that abuse it, they are crushed. People are now crushing it, taking it as in form of cocaine. I've heard a saying that say tramadol is the poor man's narcotic, kind of poor man's cocaine. Right, so this is the dangerous ways that people are taking tramadol, which is very bad, which is the worst way you can take tramadol. This can lead to little doses and the person can die on the spot. So you can see how dependability this drug is. Now, having known about this, every parent, every person should be aware and careful of their children, their wards, their young adults, and even your friends. Most of them may be going through withdrawal symptoms. If you notice that your child has developed things like unnecessary absent-mindedness, unnecessary long hour sleeping, euphoric states all of the time, lack of concentration, please try to find out what is going on with them. Now, having known about this, let's talk about 7 ways you can stop tramadol if you're trying to stop tramadol. Meanwhile, please don't forget to subscribe and like this video, because I'm sure I'm helping you a lot. Number 1, if you're trying to stop tramadol, first of all, talk to a doctor. Please do not try to stop tramadol on your own, especially if you've been dependent, because they may be serious withdrawal symptoms, like I've told you. So talk to your doctor. He knows what to do so that he can monitor you. Number 2, go to a hospital or a withdrawal facility. Now, they are a place that is designed for, let me just go, because most people might be watching from different countries. When you go to the hospital, there's a way they will monitor you, give you some drugs that those withdrawal symptoms, you may not really experience it like you would have, and you will be monitored so that you will not cause danger to yourself and to others. Number three, do not stop Tramadol, rather reduce Tramadol. If you stop Tramadol immediately, the withdrawal symptoms can be so intense that it can lead to convulsion, it can lead to death. Tramadol withdrawal, even some other drugs that are dependent, generally you stop it gradually. From gradually stopping it, you can be taking, if you're taking 2 tablets, you'll be taking one. If you're taking 3 times in a day, you can be taking 2 times in a day, with the mind and aim that you want to stop gradually. This is how you stop, from 3 times in a day to 2, from 2, 1, with the dosages. This way you can easily wean off of Tramadol. Remember, do not try to stop on your own. Make sure you are under a supervised vision of a certified doctor, not a chemist. Please be mindful. Again, so if you've been taking let me explain again, 3 times in a day, 2 pills 3 times in a day, you start by taking 1 pill 3 times in a day. Then from 1 pill 3 times in a day, you start by taking 1 pill 2 times in a day. From 1 pill 2 times in a day, you start taking 1 pill 1 time in a day. This is how you will do until you gradually continue taking half tablet a week. This will give your body time to adjust to the effects of the Tramadol and gradually deceive your body as you wean off until the doses. This has to do with your blood. So many of them are in your blood. So when you stop abruptly, that is when you're going to notice all of those signs and symptoms I mentioned earlier. So this is your way your body can gradually adjust to it, and then by that means you stop. Now, the next thing to do, I presume number 4, is please take care of yourself. Take care of yourself. Eating good, nutritious food, eat healthy food. Most people on drugs, they don't eat. Yeah, that's one of the most similar symptoms with all of them. They don't eat. So, but eat nutritious food. This will help you, mild the symptoms that the withdrawal symptoms may give you. For instance, so that the dizziness, you can imagine being dizzy with an empty stomach. This is very bad. Very important. Please make sure you take lots and lots of water. This is very good. It will help you your kidney make lots of urine and detoxify your system. Take lots of water. Now try to have hot bath. Okay, not like hot warm bath. This will help in bone pain. Bone pain is one of the withdrawal symptoms of Tramadol. So this will really help you. Now the 5th one, I think, is please try to reduce stress or be stress free. Now, how you do this is take a nap, do the normal things you do, more especially go to the gym, dance, do the things that you love. Make sure you are busy, but make sure you don't have a lot of stress with your activities. Let your activities, engage in activities that you like. This will help, replace the Tramadol effect, because most people, that effect is there. It makes you, when you're not doing anything, there's this euphoric effect you have. But when you're busy with the way you're reducing your Tramadol pills and every other thing, it will make trying to stop very easy. So do the things you like, go out with friends, sleep, relax, drink water, eat healthy food, do things that you want to do. Now, the 6th thing you will do while trying to withdraw from Tramadol is avoid alcohol entirely. stopping alcohol is very paramount. Stop alcohol, please. This is very, very, very paramount, because even a small dose of tramadol, that one pill that you're trying to stop, that you're taking, maybe is your last time, a pill of tramadol or a smallest dose of tramadol, when mixed with alcohol and then the withdrawal symptom, is very deadly. Yes, it can worsen or triple the symptoms you're having before. The hallucination becomes worse. You will have difficulty in breathing. You cannot breathe. It can even lead to deep coma. Coma is a state of almost to death, where you can't talk, you're unconscious, you don't know what is going on. Depression, severe panic attacks. Okay, please do not take alcohol when you are trying to stop tramadol. This is very, very important. I beg you, don't take any form of alcohol or any form of another hard drugs. Most people have the habit of, okay, they're trying to stop tramadol, and then you're trying to stop it with another hard drugs. This is the worst thing you can do for yourself. Now, the next thing to do is to join a group. Yes, try to join some group or support groups. These are groups that of people that are trying to stop one habit or the other, especially alcohol and hard drugs. Okay, this group will really help you, where you will talk about what you're going on a daily basis, how you're able to come clean. Here, it makes you to be accountable. You will see people that are better than you and people you're better off than. You will get to learn to listen to what people are going through, and this will really help you in stopping tramadol. What happened at the end of the day, where you talk about the effects you have. Okay, for instance, today, what happened last week, what happened at the end of the day, you were able to go and still take another one, or you were able to not to go and still take another one. There are some groups you can ask your doctor or browse. There are some social groups of people trying to stop all of these things. Okay, so this will really, really help you. I hope this video is nice. I hope you really enjoyed it. Let me know your opinion. Have you taken tramadol before? What are the effects? What do you think is happening? Do you have any better ways how people can stop taking tramadol? You can share your opinion on the comment section. Let us know what you feel, so that people can also learn from you in the comment section. Have questions, you can drop them, I'll answer to them. You can follow me all my social media handle at Nosmerit, and I'm going to give you I have videos on how to take care of your kidney issues, diabetes, hypertension, women's health, and share this video so that people can get to watch. Have a lovely weekend. My name is Nosmerit again. Don't forget to like and subscribe.